just to show a little bit of what I was planning, and I'm so glad that you sent the questions. I actually have an assessment table. I don't know if you can see it. Yes, right in front of a squat rack, which is rather unusual. But you're going to ask me about finding elastic equilibrium of the spine. So at that point, I'm going to sit here. I've got a studio mic, which I'll plug in just a moment.
Okay.
I have all sorts of models that I'm going to use to explain stability. I'm going to talk about stiffness and tuning the feet and all of these sorts of things for runners. And I've got different stability models that I'll use to demonstrate with. I will go to the wall and try and define elastic equilibrium for you, etc. So does all of that work for you?
Oh, it's fabulous. I'm very excited.
Okay. I'm just going to plug in a studio mic, Jami, and tell me if it's worth it. I know this room does sound a little bit hollow, but here we go now. Do you notice a difference in sound?
Yes, less echo. Very good.
Just a sec, I don't hear you. How about now?
Yes, you sound good.
Oh, there we are. So is the studio mic worth it?
Either way is good. It's a little less echoey this way, but I think it's either way is good.
All right, I'll stay with this, and when I stand up to do any demonstrations, I'm just going to pull my ears out, if that's okay.
Perfect.
And then I'll plug right back in. The other thing is, I hate to admit this, I've retired now, and I used to be so dexterous in telling stories and following continuity a little bit. My brain is forgetful now. So I'm so glad you sent the questions. If I can ask you to stay somewhat to the order, of course you can have follow-up and clarification and whatnot, but if you can stay somewhat to the order, I think I'll be able to stay on track and tell better stories for you. I've jogged my memory here with a few keywords and whatnot, if that's okay.
Yeah, no, that's very good. This is a laid back podcast, conversational, and I am so excited to be able to speak with you. I guess my first running back injury started probably, it could have been 12 years ago. I've had 3 episodes. This is my 3rd. And I met a guy that the first episode, it got so bad that I'd have to walk backwards out of a parking lot because things would, out of a grocery store because things would spasm up on me so bad. And so a running buddy recommended me to a guy, and I believe he may have worked with you. And of course, there's so many names over the years. His name is Juan Tagle. And Juan gave me your book up front because I argued with him right and left that, he said it's nerve. I said it's muscle. He said it's nerve. I said it's muscle. And, he had me doing bird dogs. And I kept wondering, is like this guy having me do bird dogs just to keep me busy until this thing heals? But the reality of it is bird dogs were the only thing that relieved my spasm in my back. So anyway, I try to keep up with, doing my 3 that you have suggested, but like every other human, you get a little cocky and lax and it goes away. But the interesting things, this last injury.
You should tell us on air. If I could examine you, Jami, I am sure I could pull you out of the acute phase much more quickly. And if you want to put this in the podcast, I could do a little bit of an explanation. But was it a sudden onset then, the acute attack?
I can't say that it was. No, I guess the biggest part was, I'm a marathon runner and have run several events in a row. And what I guess I would say the onset was sudden in the fact that the anterior nerve pain in the hip that I experienced happened on the day of the marathon. We were delayed at the start for about 45 minutes, standing in a corral, still cold. and the marathon started. And of course, like um, every crazy runner, I'm going to stick to the pace. And I started out and I felt this in my anterior hip, like I felt before, and thought, where did that come from? And and of course I kept, the idea was to do as well on the marathon as I could. And so I thought, well, this is because I'm stiff and cold and it's going to give in. But it never really let up after that. And I slowed down. I recovered from the marathon over a week or so. And to really put the nail in the coffin, I did a 39-mile weekend. And that was the final nail in the coffin that got me really, as I would say, boogered up.
You are a warrior.
So anyway,
typical athlete.
Yeah, typical athlete. So I thought we would start, we can start with, again, so I go right back to basics, get down. And what was interesting with this episode is that I was doing my planks diligently every day, 8 minutes of planks with 45, 90-degree rolls, diligently every day. So I kind of thought that I would be a little bit more protected than I was, but I wasn't doing the bird dogs. So I think that, and you can probably speak to that. I know now we're already off the topic in the question sequence, but, you can put that in the back of your mind as far as,
Yeah, that's all fine. Do you have my book, Back Mechanic?
Oh, I have all three. Yes.
Okay, good. Because
this is my favorite, and of course this.
Yeah, well, the back mechanic will get you out of pain. When you were having the acute phase, did you try the prone tummy lay and breathe and just relax? And if you did that help or not?
I didn't have that book at the time and I didn't do that, but on my belly was somewhat worse.
Well, then we would bolster your hips with a folded towel and just give a tiny bit of hip flexion. And if it happens to be neural tension, and maybe Juan was right, that takes some of the tension off the femoral root if it's coming down the front of the thigh. And then there are other tricks. We would turn your head one side or the other, and that might make quite a bit of difference to the hip.
Wow.
And then I might get you just to push your eyebrow 1 kilo or 2 pounds down into the floor, and all of a sudden the pain may go. There's all sorts of, I call it romancing the spine. We have all sorts of little tricks that I play jazz with and really hone in on the mechanism. But there are the gross tests, as you know, for whether or not it's neural tension or muscle tension. But my question for you is, have you had a good exam of the hip joint?
No. Other than,
where do you live?
I am in Florida. I am a cardiologist, internist, and I did hip mobility. I really think my hip mobility is good.
It doesn't matter. It still might be the pain trigger.
Yeah.
Where in Florida are you?
Port Charlotte, an hour south of Tampa.
Oh, I know Port Charlotte. Yeah,
my mother
used to. Yeah, my mother used to live in Port Richey.
Okay. Wow.
Yeah, just north of Tampa, Clearwater.
Yes.
Yeah. Okay. Because I do have someone who could give you a reasonable hip exam in Jacksonville, but actually I do also in Jupiter, which is across the state. But anyway, those are all things we can talk about later.
Yeah. So, when I first started this and started and read your book for the first time, to admit that you have a bad back, so to speak, is something, as an athlete, and as I'm a West Virginia girl early on, so my family were always workers, lifters, pullers, pushers, and, a bad back was a sign of weakness. So the last thing that I wanted to admit was that I had back issues. And the first time I've had MRIs of my spine and everything looked good. So there was never a disc issue or anything. Way back I had hip x-rays, and again, they looked okay. And so when I went to Juan and he started this, he introduced me to your program, he started to talk to me about, a neutral spine. And I had no idea, neutral spine and bracing. And I think that's a concept, once I guess you're the patient, you start looking at everybody else as a patient. and you start seeing, well, how people are standing. And so if you could go over with me a little bit about, just to get started, the neutral spine and how we need to do that in a daily, how we assess it. I've heard Kelly Starrett talk about, hand on the sternum and the pubic bone. And then, Juan had me do the rotation of the lumbar spine to kind of find that neutral position. So let's hear it from the horse's mouth, so to speak. How should we look at this?
Well, I try and answer every question first by establishing a scientific principle for a foundation, and then we can talk about the clinical variances and nuances about it all. So let's talk about just neutral joint posture, and what do we mean by that? Consider my elbow. So there is my elbow working through a flexion and extension range. If I can find a position of least stress, that is by definition the position of elastic equilibrium. So say it's here. If I extend my elbow, I create flexor stress. If I flex my elbow, I create extensor stress. So neutral spine is elastic equilibrium for the spine, and by definition, the lowest loaded state, and quite often the least painful. So now I'm just going to disconnect the microphone, and I'm going to stand up and just talk for just 1 minute here. I'm going to plank on the wall, and we would coach you or the patient that is hip motion. Now this is spine motion. And we will have a person work back and forth, finding that least resisted position. That is elastic equilibrium. And then to come off the wall, and they might say, you found the position of relaxation and no pain. However, I still might have a little bit of pain. And then we modulate elastic equilibrium with a little bit more extension, pelvic tilt forward, or a little bit of flexion. And they might say, that was the secret combination that took my pain away. All right, now a person is learning a strategy to find elastic equilibrium and how to create a rested, pain-free state. Then the trick is to create a muscle memory around that. So they find the position of elastic equilibrium and least pain. And then I might say, coaching, take your fingers lateral to the navel, lateral to the linea semilunaris and the rectus abdominis, and into the obliques. Push your fingers in. Now lightly push your fingers out and tune that around elastic equilibrium. Now stand on one leg and do a knee circle. Is your pain gone? And if they say yes, now we have combined finding the position of least stress. Now we're starting to build some resilient athletic capacity by using what we call stiffness. The body controls position by muscular stiffness. So when a muscle contracts, it creates force, but it also creates stiffness. And it's the stiffness that allows this flexible spine and the linkage of my body to stand up without just collapsing into the ground. So there's a little bit of a start on this discussion of what is a neutral spine. We can certainly put that into a running context, because sometimes, as you know, runners want elastic recoil. We may not want to be in joint elastic equilibrium through the body, and we want it to be, become kangaroos basically to run. And there's some thought about tuning strategic stiffness.
Okay. All right. So it's not one size fits all. It's to the individual. So if we could, I'm not sure, I talked about running lumbar stability as the second question, but maybe we should progress a little bit different. Again, I guess let's just go right into it, because I think I find it interesting. I hope the listeners do. So I typically get into trouble when I do high mileage and speed work. That's when this occurs. So 50 miles a week, throwing in 2 or 3 sessions of speed work, trying to push the tempos, and then boom. So what happens if we're going to assume, and I'm really, most of the time the symptoms have either been anterior hip, I've had it in the butt, you know, on the side of the leg. It's varied. And the first time that it happened to me, people argued. I saw an orthopedic guy when it first happened, and he was trying to say, well, it's in your hip, perhaps. And where does it hurt? And I could point one place. If you start to walk, well, it might hurt in the front, then it hurts in the back, then it hurts in the side. So there was not a like I can push here and it hurts, or I can rotate my hip. You know what I mean? It's migratory, which again, meant that it was, again, more nerve pain as well. When I don't move, I'm pretty good. It was when I would move. And so how does one get themselves, what happens in the nerve that causes this to go, this electric activity to just kind of snap?
Well, if I can back up just a tiny bit, Jami, it sounds to me as though you've never had a really thorough assessment of the pain mechanism. The pain might be singular in its source, or there might be many things going on. And usually in athletes, there are more than one thing going on, because we live in a linkage, as you know.
Right.
And what the mechanics of one link certainly gets propagated through the chain. But then right now, obviously, I can't assess you by putting my hands on you. I could do some assessment tests through the ether of the internet, if you will. But right now, I'm just going to start by doing a little bit of pattern recognition. So when you tell me that the pain migrates, that tells me that there's more than one source. The first thing I would do is do a thorough assessment of the hip joint. We would probe the range of motion. I would load it. I would shear it. And then we would start to separate out what is joint labrum, what is joint capsule, what is the cartilaginous surface, all through mechanical probes. We would selectively probe and purposefully irritate each one of these tissues and see if that replicates your familiar pain. However, hip pain, if it's anterior in character and goes down your medial thigh or just into the groin area a little bit, that's more hip joint. If it's more lateral, the pattern is now, it's probably a bit more neural. And as you know, the femoral roots from L1, 2, and 3 come around the torso and into the upper thigh. Whereas a L4 and an L5 root, that goes into your butt, as you say, and we would follow that track down. But we would pull on those two nerve roots with strategic joint positioning. And then I would pull the nerve root from above with strategic cervical spine position and arm position and whatnot. Excuse me. And we would ferret out whether it is neural tension. Sometimes it's neural friction. So if you had a little bit of a dynamic disc bulge, which I can show in a model here, the disc bulge shrinks and grows based on physical exposure. So when you tell me this only occurs during certain mileage per week, I would then be looking at that kind of a mechanism. Nonetheless, say it did turn out to be a disc bulge that was changing shape, we would decompress that disc bulge. And again, we would use a strategy like a prone lay, as you know, in back mechanic. And I might play even within that with adding a little bit of stiffness, perhaps asking you to push an eyebrow down into the table while we did that to see if we can modulate the pain. So we'll keep probing and working back up the diagnostic tree to find the primary mechanism. But you also said the pain changes, and here's yet another possibility. So if we were to look at this pelvis and lumbar model, let's assume L3 disc is normal, L5 disc is normal, but L4 now has lost a little bit of height. Observe, here's a person running. Do you see now the majority of the micro movements occurring in the joint, or at the joint that's lost its inherent stiffness through a little bit of damage? As the joint changes conformation at the joint of least stiffness, and of course you can't see this on an MR, you say your medical images are quite fine. Well, I would probe your spine mechanically and see if we could find some laxity or instability at a specific joint, and then link that to the nerve roots that your symptoms are occurring. So again, we can become fairly precise in understanding, but if you have those kinds of micro movements, that is another character in the pattern recognition that I'm doing with you when you tell me your symptoms change from the front of the thigh to the posterior thigh, around your sacroiliac joints, etc. So it could be neural, it could be hip joint itself, it could be both, and it could be something in your knee, foot, or ankle that's causing you to internally rotate, and now that is triggering a extra load in the hip joint. So when you reach mile number 50, do you see what I mean? So there's layers upon layers, but a very thorough assessment will suss this out for you.
So again, one size doesn't fit all. People, one of the big things that you see in running injuries and common problems, we sit all day, then we go out and exercise. People talk about psoas, that muscle being tight and that causing part of the injury. And that's really what I kind of was attributing things to, because I could feel something release on my anterior leg. When I did psoas, when I did to look at, tightness, the first time, when it first was really bad, I, laid on the table, one leg up to my chest, my leg didn't go down to the table, so I had a lot of tightness in that area. So, my first stupid human trick was to say, well, okay, we're just going to stretch this out. Don't go crazy on me here, because I know, so I'll do these stretches to get my psoas to release, and then I'll be better. Well, that really irritated things when I tried to, let's just pull it loose.
Aha, I've just done some more pattern recognition then. So when you say one size does not fit all, you're absolutely correct. Now, there are some runners who do very well with psoas stretching, particularly those who spend a long time in front of the computer sitting. And they'll do a typical psoas stretch where they'll stand, maybe grab the ankle and do this kind of a stretch. But that is not a psoas stretch, interestingly enough. You have to separate out iliacus from the psoas. Iliacus just crosses the hip joint. Psoas runs all the way up the spine. So I'm doing a split lunge now, if you can see that. Mm-hmm. To get psoas, I'm going to push my arm right up over my head, deepen into the split lunge, and now I'm going to lean away. And if you can see my hand, I'm going to spiral my hand around like this, so that the fascial train, which connects psoas, believe it or not, through the anterior chain and out my arm, I can tighten and release psoas. If it is psoas, I will feel and palpate the tendon in the iliopectineal notch change as a function. So again, psoas stretching is quite a scientific endeavor, whether you are at that level or not. But that would show me if there is indeed not only a tight psoas, but a fascial connection there. Some people have it, some people don't. Others have what we call, now what's the first word? It's a neurofacilitation, nonetheless. We did this experiment with doing therapeutic arthrograms on hip joints. We gave people hip pain as they were having therapeutic arthrograms. We measured the gluteal muscles being inhibited, so arthrogenic inhibition. But there are some people who get arthrogenic facilitation of the psoas because of sitting. Not everybody, but some do. So that link with sitting is very true and important with some people. But it might be nerve. Now, if it turned out to be a nerve, say a femoral nerve root, and you treated it like a psoas that needed stretching, that would irritate it and quite often makes it worse. So there are a few strategies there. As you know, following along in back mechanic, there's a whole section on spine hygiene, which the key there is to learn movement hacks to get through the activities of daily life, not triggering the pain mechanism and allowing it to wind down. So it's akin to a person who stubs their toe and their toe is sore. And then the next day they accidentally stub it again. Well, now it really hurts. So by the third day they stub their toe, all they have to do is lightly touch it. And neurologically, they so centrally sensitize that toe. Well, people do this with various tissues in their body, not realizing it. So we desensitize the neurological windup of pain by using the tricks of spine hygiene. So that might be very key in the person's program as well in winding it down. Now we've built a little bit of pain-free capacity. Now it's time to get the nerve roots not to stretch, but to floss. And the science on nerve flossing shows that to floss a sciatic root is a very different strategy from a femoral root. I'd love to meet you in person.
I may have to fly out.
Yeah, well, that's what people do here. They fly in from around the world. And we would see what's going on with the femoral root, because that's the pathway that you're describing to me. And it may turn out that at mile 50, there's a little bit of inflammatory soup that develops. And now the key is don't stretch the nerve root, but floss it through the soup. And once again, the science shows that mobilizing rather than stretching the nerve clears out the inflammatory soup a lot faster. So once again, depending on the mechanism, it really targets our intervention for that particular person.
What is the difference between femoral flossing versus a lumbar flossing?
Well, a sciatic floss, the sciatic nerve, maybe I could show best on a full model of the spine. So if you can you see this?
Yes.
Jami?
Yes.
Okay, so there's the pelvis. The lower two lumbar levels form the sciatic plexus, which goes around the sacroiliac joint. So people quite often mistake sacroiliac pain for something in the lumbar spine, perhaps a disc bulge, often mimics like sacroiliac pain. It goes behind the hip joint. And there, if I just palpate the posterior capsule of the hip joint, I get right on the sciatic nerve. If I press that, that can cause their distally radiating symptoms or mimic their back pain. You see, it's not the hip or the sacroiliac joint. It is a nerve root that is irritated higher up. And that follows down behind the hip, crosses usually at the knee, down the lateral shank, and L5 goes to the big toe, L4 goes to the little toes. So knowing that anatomy, if you can see me sitting here, a nerve floss would be, I'm going to extend my knee as I drop my head back in cervical extension. Now I flex my neck and I flex my knee and point my toes. So if you can see that, I'm actually doing this to the sciatic tract. Now, some people turn that into a stretch, which is a mistake. It is the mobilization where the therapy occurs. Now, a femoral root are these three right here, L1, 2, and 3. They form a plexus that comes down anterior down the thigh. Now, that is a little bit different. So a femoral floss is as I extend my neck, I flex my knee. So that can be done in prone lying positions, if you can imagine that. So with you, I don't know if you do have an unstable joint, one that's lost a bit of stiffness. I suspect you do.
I will tell you that what you just described helped me. So of the things that when it was really, so at the height of the discomfort, if, like you said, if the dog ran into me or I tripped, it would, this electrical impulse and spasm would occur. But I noticed that if I put my my foot on the back of, and it really, I did it in the shower, to tell you the truth, standing with a, what I considered bracing my spine and putting my foot back against the wall, like you did that. You had your leg backwards and pushing. That felt great.
Okay, more pattern recognition. What you're describing is a movement catch. So people who move and then they get a little shot of pain, or some people report it's a big knife going into my
Yes,
back.
it's the knife.
Okay, so that is a movement catch. I will bet $1,000 right now, I will put it on the table, that you will have little micro movements occurring in shear at probably L3, L4. Now,
Okay.
I might be off a level on that, but I would bet $1,000.
Okay.
So when you move a certain way, you get a little bit of a trap or a trigger. But you've described a perfect femoral root pathway. So again, it's very irresponsible for me now to create a program for you after this little bit. But here's a hypothesis for you. And again, I think it would be a pretty good bet. You will do well with some base stabilization training in your core, which acts as a girdle around the joint that has micro movements. So now you need a tuned stiffness. Interestingly enough, naturally running creates that tuned stiffness. You don't need any extra. However, you probably need extra when the dog runs into you, or you have a little, you're opening the door or something like that, because you're not under load. When you're running, you're athletic, you're under load, you're standing tall, you're using the springs, you're naturally recruiting that stiffness because you need the performance. But you're getting into situations where you leave yourself open in daily life. So I think we'd have to work on a little bit of spine hygiene with you as well.
Well, and okay, so, to really throw myself under the bus,
But by the way, yoga right now is not your friend.
And I will tell you, in the past, when I do this, it has not been my friend.
No,
it always is. So
yoga doesn't fit this pattern.
I've always thought that I'm more hypermobile than stiff.
Right.
Even my joints, I'm actually, more loosey-goosey than I got to stretch something.
Right.
But the other thing was that probably even triggered this more, as I was watching, there's a guy that's a beautiful ultra runner, and he's 6'2" and probably 30 years old, 27. And he has this long stride, and he kicks out, and he, really extends behind him. And, my 57-year-old self decided that I was, my 5'5", 57-year-old self decided that I was 6'2" and 30, and that I would focus on trying to extend that stride. So on top of high mileage and speed work, I think that, that was probably, a lot of it. Let's make it bigger. And if that is unstable there, I can imagine now that how I really triggered, I really kept adding injury to injury.
Yes. Oh, the stories I could tell you, Jami, because as you're probably aware, we've had top level athletes from just about every athletic endeavor you can think of from around the world here. And I think of one world-class marathoner that we had here. And this is so cultural in training. There are some training cultures, and I'm going to include the American marathon long distance running culture in this. They tend to emphasize stretching, but that's not in all cultures. Quite the opposite, actually. So I said to this marathoner, as I say to every athlete, tell me about your back pain, and then we do the assessment. But I always say to an athlete, if I was a genie and could grant you one athletic wish, what would it be? What's the one thing that if I gave to you, it would enhance your performance? And he said, well, no one's ever asked me that before, but the weakest part of my game is the first 2 miles are slow. And it's always been my strategy. I have to work through the runners in front of me, play catch up, and try and win at the end. I said, really? Tell me about your warm-up. And he said, what do you mean? Tell me about I said, be very, very precise. What is your warm-up routine? And he showed me all these lovely stretches, you know, the typical running stretch, stretching out the Achilles tendon and all this kind of thing. And I said, do you ever have any Achilles trouble? He says, no. And I said, well, you just stole your athleticism. You forced yourself to run on muscle rather than becoming a kangaroo, where you now add stiffness to your foot and your leg, and you just become a bunny rabbit. So now I want you to stop all that stretching. Do you remember that nervous kid in public school who would sit beside you and bounce their foot on the floor? That's called a foot ricochet. That is beautiful neurological training to tune stiffness. So as an experiment, just have a stretched out lower leg and try and get a ricochet, and you'll notice all your heel just hits the ground and stays there. Now, really co-contract your foot, your calf, your tibialis anterior, turn it to steel, and you notice you get exactly the same thing. Now back off somewhere between the two, and all of a sudden you get a beautiful ricochet going. You have storage and recovery of short range elastic stiffness. You just turned yourself from an athlete who pushes to bam, that's an athlete. So we replaced all of his inappropriate stretching, which not only killed the neurological stiffness that we wanted, it caused relaxation, but it stretched out the natural springs. And I said, good, you're going to do some pogo jumps, you're going to do some foot ricochets. And he came back later, and of course, you know the story. He said, my back pain is gone, and I just ran the fastest marathon of all time.
Nice.
Fastest first 2 miles. So, you know, it's so interesting how tradition often puts the brakes on athletic performance and causes stress concentrations and pain. But there's a nice little story about elasticity, and really know what your training goal is through assessment, and then go for it by all in.
That's actually very interesting, because there's a guy, I'm blocking on his name right now, but he holds the world record for a 75-year-old man breaking a 3-hour marathon. And Gene Dykes is the guy's name. And what he said in his interview was that he never stretches. Never stretches, never at all. And you can see the guy, he's got this, you know, little bouncy stride that just goes down. It's not this big, long stride, but it is this, you know, just tight as can be down the road, motoring down the road. So that's very, very interesting.
Yeah, for what you're telling me about your base athleticism and what God blessed you with, which was a wonderfully mobile body, it sounds to me that strategic stiffening will not only reduce the stress and load concentrations, because here's another experiment, and these were one professor who was very influential on me as a PhD student 35 years ago was a fellow named Dave Winter. And this was right when the athletic marathon shoe companies were building in the air soles and the big padding. And people were saying, well, we reduce impact and it's so good. And he said, that's not what our calculations show. Because when you land on a soft cushion, you have to eccentrically load with the muscles and then push off with the muscles. Now measure the cost to the joint of all of that muscle crushing action on the joint. It was actually higher than using the springs and having more of a sharper impact. And it's interesting, as you know, over the years, the padding has certainly decreased for marathoners. But for actual speed runners, not people who are just putting in mileage to train, but we're talking about actual athletic performance, you probably want to decrease the amount of cushioning and really take advantage of the natural springs.
Perfect. Yeah, that is, people, again, over the years, you watch the shoe companies, they've gone, when Born to Run, that book came out, people went to almost running in a sandal to, now Hoka's out and let's get the padding back. And I have seen those studies where people actually hit harder when there's more padding under their feet, because again, the proprioception is diminished as well. So
Yes.
if we turn this, my practice is based on a general wellness practice. We do focus a lot on nutrition to reverse lifestyle diseases, but I have a lot of we encourage movement. Trying to get people off the couch, moving. And a lot of people say, I have, it hurts to walk, whether they might have a diabetic neuropathy part of it, but a lot of people have chronic back pain. And, one of the things in your book, you talk about, get out and walk with good posture, but move, not just a easy, walking on eggs down the street, but take off. So tell me about that.
Well, walking is non-negotiable for good health from every system in the body. You're the expert in cardiovascular. I know a little bit about musculoskeletal, neurological. You cannot beat walking. It's absolutely fabulous. But let's take a person who has back pain that is preventing them from walk. Well, it is a progression. We get them to stand with good posture, ears over the shoulders, shoulders over the hips, hips over the knees, and then that thrust line down through the middle of the foot. And just learn how to find that. And some people are clueless. I ask them, feel the muscles in your back, and they're just rock hard. No wonder standing and walking hurts. But when I say, can we get the ears over the shoulder? All of a sudden they say, oh, my back muscles just shut off through that postural change. Now we've built the capacity to even walk to the end of the driveway and back. But this is a continuum. And then we get them just to learn to march, just like you're doing, say, a running workshop. Start with barefoot, learn the mechanics, and then get right back to the fundamentals. And then all of a sudden you're running pain-free again with beautiful mobility, elastic storage and recovery, etc. So we use walking in the same way. But let me just go back to the mechanics of walking. Just consider, when I stand on one leg, my hip wants to collapse down into the ground. That is a stress on the spine. So the muscles on this side, primarily quadratus lumborum and the obliques, hold my pelvic platform up and allow me to walk. What is so interesting that if you go to the neurology ward at the hospital, particularly younger children who have a paralyzed quadratus lumborum, do you know they can't walk? That's how important the torso or the core is for walking. Because if they've got a paralyzed quadratus lumborum on that side, when they go into stance on that side, no issue. But when they go to stance on the other side and leg swing on the deficit side, the whole pelvis falls. So it's proof how important walking is for challenging the frontal plane athleticism all the way up through the linkage. And when we measure world-class strongmen, for example, carrying heavy loads, they carry the load, believe it or not only through hip abduction, but they also use their core very strategically. And it allows them to be more athletic and carry more load than their hips are capable of. So walking is numero uno for frontal plane health and strength of the spine. Then we get into all the other issues about balancing the tissues like psoas and iliacus. Walking, swinging the arms about the shoulders is a wonderful natural nerve floss for all of the neural roots of the lumbar spine. It's just good medicine all around. And the problem is, people these days sit too much and walk too little.
Yeah. So you brought up a really interesting question for me. So when all this came about for me, the first thing I did, look in the mirror, look at my hips and pick one leg up. And of course, it was hard to stand on the affected side because it hurt. That would trigger all the nerve discomfort picking one foot up. And so I would try to brace, and get myself neutral as I could. And I'd brace as tight as I could. And I'd try to pick my foot up. And what I noticed is when I picked I'm going to stand up. When I would pick, this is the bad leg, the right one. If I pick the left leg up, the first thing I would do is shift. I would do this. And then it's like, whoa, what happened there? I didn't realize I was doing that. So then I would stiffen again and I would, pull it up. So immediately I thought, well, is this a glute medial problem? But now you're saying that this was probably, again, that femoral root, that quadratus, that was what's being inhibited, correct?
I can't say for sure, but I could say our assessment would prove it conclusively what it is. But uh, now you've just revealed to me something just a little bit more. So the funk is on your right hip, is it?
Correct.
Yeah. Uh, there's wheels within wheels going on here, and a good assessment would source it down for you. One of these days, I'll see you.
Yeah,
But
but it's not. But when you, again, when you go online, and that's the confusion that a lot of people have, myself included. People talk about the glute medius. You've not mentioned glute medius not firing so much right at this stage in the walking part of things.
yes, I know, because the people who are usually on the internet talking about glute med, I'm sorry, have never measured glute med. Uh, they haven't measured, as we have, all of the players of the orchestra to see how they work together. And it's quite often, oh, it's a default, it's piriformis or glute med, and it's a simplistic explanation. I'm not saying it's not glute med, but chances are it's, you know, Trendelenburg's sign, which is what you just demonstrated there.
Mm-hmm.
They chalk it up to glute med. And what I just discussed and what you just realized is probably the more dominant determinant of that is quadratus lumborum on the other side.
Yeah.
Yeah, but who was the first guy in the world to implant quadratus lumborum with EMG electrodes and measure it? Me. I was the first guy in the world to have it implanted on myself. So, you know, and then we did groups of athletes, etc. We did all of that work on the Swiss national athletes in the 1990s. But anyway, it may very well be the glute medius. And interestingly enough, when you look at the gluteals, people talk about glute med, glute min, and glute max as if they're three separate muscles. But neurologically, there's really only two neuromuscular compartments. There's the high glute, the lateral glute, and this is non-negotiable for walking. But people say, oh, I'm going to do squats and all of that for my glutes. But you have to squat very, very deeply to get the big meat of the lower glute involved. So this squat here is really hamstrings until I get about halfway down, and then the gluteals become involved. But anyway,
back. Go ahead. Glute med.
Well, you know, to start doing hip airplanes with internal rotation and external rotation like that coming around is much more of a glute med, a high glute kind of challenge, so to speak. But it may be glute med in concert with the contralateral quadratus lumborum. I don't know. But I'll ask you a question now. Maybe the person has a medial collateral deficit on the right knee, causing the knee to go into valgal collapse. What's going on at the hip? It overstresses glute med and piriformis now, and they say, oh, I've got a tear in my piriformis. Yes, you may have, but why did it occur on the right side and never the left? It might be the knee or the ankle rolling, or do you see what I mean?
Oh yeah, there's just so many things that, and then again, when you throw fatigue into chronic distance and running, then, you know, your bad form and your compensation mechanisms start to, you know, get in, and you know, you just go down a rabbit hole. And of course, you know, I kind of, I guess I liken it to when I try to fix my own computer, I push a lot of buttons. And then the computer expert will say, what did you do? And it's like, I'm not sure. And, you know, and it's the same way when I get injured, I push a lot of buttons and I'm not sure.
Yeah,
you know?
But we always, we ask for videotapes of, I want to see your first 2 miles, I want to see your middle 2 miles, and I want to see your last 2 miles. And we'll start to see where fatigue, and then even in our assessments here, we will take athletes into deep water in terms of fatigue. I'm only just showing you one end of BackFit Pro, but we've got all kinds of gizmos here where we take athletes into their performance world, and the injury mechanisms or pain-causing mechanisms don't occur until they get into a very fatigued situation. So, you know, the rehab might be, think of what the coaches are yelling at athletes. They're now at mile 20. Keep good form. Don't lose good form, you know, and it could be in the Olympics, in the gymnastic sports. It could be in running. You know, think of MMA and jiu-jitsu. It's all the same thing. Fatigue is a killer for many athletes.
Stability, yeah. And you know, as we go down the list that we had talked about, you know, the buzzwords, you must go crazy over the years when, you know, you hear people talk about core training and you see the person on TV and they're doing all these crunches and, you know, back and forth, and you know, what do you call it? Boot camps. You know, the boot camp. When I hear one of my patients are signed up for boot camp, I know they're signing up for an injury pretty soon. Because you know, it's like, how do I punish myself for years of neglect? I'm going to beat myself up in 2 weeks, you know, and injure something. But it typically, you know, revolves around, you know, we're going to do the core training and we're going to do these, you know, sit-ups and twists and all this kind of crazy stuff.
Well, I certainly have opinions on that, but yes, I agree with you. It's interesting when you study the training of the athletes who are world class and have longevity. They would never do something like a boot camp. Just to talk about a scientific principle that would be overarching on that discussion. The body has a tipping point. Now think of vitamin D. Let's just use that as a nutritional example. A fat-soluble vitamin. If you are deficient in vitamin D, you're sick. So you take a vitamin D supplement or go in the sun or whatever it is to an optimum level. But once you cross the optimum, you cross the tipping point, more vitamin D becomes a poison. So it's an inverted U. Well, physical activity, while the health of every system in the body depends on movement and activity, every single one of them has a tipping point. Not too much and not too little. The job of a master trainer, or we'll put ourselves into the category of master clinicians, you know, in a cardiac sense, whether or it's a spine sense, it's exactly the same principle. We have to operate below the tipping point. Everything below the tipping point is anabolic. It's building. When you cross the tipping point, we get cumulative microtrauma that will manifest into macro trauma. In other words, the rate of tearing the system down exceeds the rate of repair. So why do we train? We train to create a positive anabolic adaptation in the body. So our job, in a nutshell, is to keep expanding the tipping point and the region underneath it, but never cross it. Now, think of boot camp. You just violated everything I just discussed. So pulling a person out of pain and giving them more ability with their body, it's not haphazard. And I would suggest that most trainers at the elite level don't have the expertise to pull all their clients through that. It's an art and a science. But the elite ones, the master trainers, know how to do this. And they never have large increments in load. It's always a very cautious, say a 10% increase in workload, and then you monitor, see how the person is doing. You might dip your toe in the water and add a bit of load, add a bit of duration, add a bit of intensity, whatever it is, and then just monitor to see the person's reaction. And if they get a little bit of a negative reaction, you've got to withdraw. The adaptation isn't keeping up. So every training session really ought to give the athlete or the person more than it took away. But there's this myth that boot camp, oh, that was a great trainer. They beat me up and I was sore for a week. No, actually, you just took yourself out of action for a week. It was the most destructive thing you can do for your long-term athleticism. Just keep, anyway, there's a little bit of a philosophical and a scientific foundation to govern that whole discussion.
I think that is really good.
Can I say something, Jamie? This might be the part now. I'm a little older than you. I'm in my mid-60s, and I have zero pain. Now, in my 20s, 30s, 40s, and 50s, I had pain. I had neck pain, shoulder pain, hip pain. Now I have had hip replacement. That helps. But anyway, I retired from the university. I don't sit as long at the computer. I get up. The first thing I do every day is I go for a walk with my dog. It's absolutely wonderful. I don't even turn on the computer. But my point is this. I am now probably, relatively speaking for my age, in the best shape. I used to do some fairly heavy athletics when I was younger, but here's a philosophical training program that really suits people at this stage of our life. 2 days a week, I focus on something strength, a little bit of strength training. I might be here at BackFit Pro. I might go outside and split some firewood, doesn't matter. 2 days a week, I work on the things that are a little bit stuck. So I broke my neck as a young 20-year-old. I have to do a little bit of neck mobility. Obviously, I have to do hip mobility. I do a little bit of mobility with my wrists and ankles. 2 days a week, I do something to get the ticker charged up. I might go for a swim, a bike ride, a ski, or whatever the season gives me. And every day I do my physical work. But if I haven't done strength for the previous 3 days, I add that in. So 2 days a week is strength, 2 days a week focus mobility, 2 days a week the cardiovascular side of things. The seventh day, I rest. This is what people miss. All of those other days were simply stimulating adaptation. You have to have the rest to allow the adaptation to occur. When you can find that for your own body, you hit a wonderful sweet spot. And anyway, there's a little bit of wisdom that might help a lot of your listeners.
Yeah, no, I do think that's really good. One of the last training programs that I went through instituted a day of rest. And at first it's like, oh, what will I do? But I began to actually look forward and enjoy that day. I'd take a gentle walk with the dogs, but otherwise, not much else. So I think that's very, very good advice. We went down the road of the stretching. I'm not going to keep you much more but I think this hamstring tightness, overstretching. I believe that let's just talk about your big three real quick, because I think those are important. How often do you do the big three?
Every day.
Good.
Except the seventh. But 6 days a week, I do them. And there's, again, let's go back to the science. For 30 years, we evaluated different exercises, trying to find the way to create torso strategic stiffness and stability. And we didn't really get into the mechanics of that. But if we take a flexible rod like this, which is your spine, we'll put in a little bit of lordosis, a little bit of kyphosis, that can bear load. It allows me to carry my grandchildren. It allows me to work and be robust. But it's stiffness that allows that flexible rod to bear load. Now I'm going to take some stiffness away, and you'll see the spine collapses right away. So the first issue was, what's the most efficient way for people to create stiffness and athleticism? The big three. They kept popping up as the superior exercises. So I first published those in the American College of Sports Medicine book on exercise prescription. They asked me to write the spine stability program. So the modified curl up for the front, the side plank family, regress and progress, For the sides, quadratus lumborum, as you've heard, is very important, the obliques, etc. And then the bird dog for the back exercises, and there's various progressions there. But that won't get you to the Olympics. You know, I think of people like jujitsu fighters, for example, or martial artists, and it's tradition to do, say, 300 sit-ups every day, which is fine. They're wonderful athletes until they're 23, 24, 25, and now their discs are getting a little bit angry. We replace doing the sit-ups with the modified curl up and the big three program, and then we might do things like a front plank and progress that to stir the pot on an exercise ball, for example. And then don't go near a sit-up. And think of the military, where in the past, the annual fitness test always involved speed sit-ups. Well, no longer. The Navy has switched. The Army, the Air Force has switched. I did a little bit of consulting with them on all of this, but nonetheless, don't do the speed sit-ups. Do the stir the pot, the plank, etc. Interestingly enough, when the soldiers and sailors and airmen then do the speed sit-up test, they have less back pain and they perform better doing the speed sit-ups. So there you go. You can avoid the injury mechanism, become more resilient and more athletic if you know the tools of the trade.
Very, very good. Well, this has been absolutely wonderful. I'm looking. Your books are great. Like I said, I have all I think the latest one was the Back Mechanic, right? That's the last book that came out.
No, not really. I wrote each book for a different audience. The book I wrote for the lay public who have back pain, that was Back Mechanic. And as you know, it guides the person through a self-assessment of their pain and then shows them how to strategically tune their body. You have Ultimate Back Fitness, which I wrote for athletes and coaches to then restore athleticism. The book I wrote for clinicians, doctors, physios, etc., is Low Back Disorders, and that shows the full assessment and that kind of thing. But then there was a world-class strongman, Brian Carroll, who lives in Jacksonville, Florida, a neighbor of yours. He held world records in 2 different weight categories for squatting the most load. He had quite a horrific back injury. And I said to him when we were working on his rehab, or he said to me, he says, I want my world record back. And I said, well, Brian, let's get you out of pain, but if you can ever get your world record back, that's a book right there. So you know the story. And we ended up writing a book called The Gift of Injury, and how, when you think of that title, his horrific back injury caused him to now use science to train. And he was able to adapt his spine through the injury with proper mechanostimulation. Then we organized the neural side of things to really create dense neural drive and the strength. And long story short, he won the Arnold's competition 2 years after that. And then the year after that, just to prove it wasn't a fluke. So that was the most recent book. And it's the story of how strength athletes can regain load-bearing ability and strength again following back injury. Does it work for everybody? No. There's some people who obviously they're in a rough spot, but it's helped an awful lot of people if you read the Amazon reviews. But anyway, those are the different books.
Well, I will. I'm going to put a shout out. My son-in-law is the strength coach for the University of Houston football team, and he is a big McGill Big Three follower and teaches that to his athletes. So, they're really following your program there.
Well, if you want a story on that, last year I gave a talk to the NFL Strength Training Coaches Association, and most teams in the NFL actually start every weight training session and on-field session with the big three, because it adds, as we discovered, a residual stiffness. So you might find after you do the big three, you stand up and you feel a little bit more stable and athletic for half an hour. Some athletes are about an hour. And what that does is when you're running, it settles down the micro movements, but you get better power transmission across the hip. So the hip flexors and the hip extensors, as you know, they cross the hip. Distally, you want them to propel the thigh. Proximally, they bend the spine. So if you can stiffen down some of the proximal bending, you now get more power distal to the ball and socket joint, which is the hip and the shoulder. So you actually create distal athleticism through proximal stiffness and control, and that's facilitated by the big three. So that's why quite a number of the NFL teams now create that proximal control and stiffness to create more distal power. They run and cut a little bit faster, for example.
So the low back stiffness is actually contributing. So you can, again, if I, apply it to yours truly, when you get tired and you let your become less stiff, and you let your lumbar spine is giving your that little extra length, as opposed to, again, the stiffness and the rabbit, and the jackrabbit thing, that actually does more damage. So the more you can keep the spine stiff, the better you're going to be.
From the patterns that I recognized from you,
Yes.
I would say yes.
Yes.
But until I assess you, I won't be 100% sure. I'm just going to have to stay, I'm about 90% sure, just
good.
listening to your story. But think about this. When you are starting to hit the wall, so to speak, and you're getting into that little bit of a back issue that you feel is pending, if you were to restore good form and get that storage and recovery of elastic energy into a tuned spring. So there is a spring. If it's lax, the tissue just bends, and you're actually stressing it. But what you want is a boing, 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 if you know what I mean, with each stride when you're running. It's much less stress on the joints, and it's much more athletic, and you use actually less muscle.
Yes.
Because now you're running on the springs rather than running on that concentric, eccentric muscle contraction cycles.
Beautiful. Well, like I said, I can't thank you enough for taking the call and taking time with me, and definitely going to have to visit you at some point. And hopefully won't be your craziest evaluation from all that.
I can promise you it won't be.
And so the best to you, and thank you for all the work that you do. You're very inspiring, and great. Maybe we'll have to have you down here for one of our conferences.
Well, who knows? I'll just mention, in this COVID situation, and for Amazon, I know they are lagging in their book deliveries. So if people want any of the books now, just go to our website, backfitpro.com.
Okay.
And they can get them immediately.
All right. I'll shift everybody to your website to check things out. And
yeah. Okay. Perfect. And let us know. And Sarah from BackFit Pro will make a link to your podcast and
beautiful.
Send some traffic towards you.
Thank you so much, Doctor.
Okay. Good luck to you.
All right.
Nice to meet you.
Have a nice weekend.
You too. Bye-bye.
Bye-bye.